welcome you to the second episode of the Perioperative Perspectives Podcast, where we'll dive into real-world conversations about the challenges and triumphs shaping healthcare today. We're so thrilled that you're joining us for today's episode, which focuses on a topic that often operates behind the scenes but carries profound daily influence: ethics in healthcare. Without further ado, I'd like to welcome Dr. Lesandrini.
Well, thank
May
you.
I call you Jason?
Of course. Nobody calls me doctor, so Jason is great.
Well, I thought it was nice to do that this morning.
Well, thank you. I appreciate that.
So let's start on our first question for you this morning. Can you start by painting a picture for our listeners? What does ethical leadership look like in action during a typical day for most leaders?
Yeah, it's a good way to sort of frame the conversation. I want to thank you guys all for this opportunity first before I go forward. Really will hopefully enjoy the opportunity to sort of share some stuff with the listening audience and really to learn together as we'll go out today. So, what does ethical leadership look like in a day-to-day function, for the members? I think we have this misnomer that somehow ethical leadership is about grand gestures. That, oh, look at me, I've done this right thing, I've done X, Y, and Z. And the reality is it's not. It's really about being woven into the fabric of the daily interactions of the leader and the team member within the organization. So I can imagine, a nurse leader who might be doing rounds or checking equipment or doing things with their team members, asking about their well-being. And in those situations, we can exude ethical leadership. And so what we see with ethical leaders is that they're making decisions daily in a particular kind of way. They're thinking about how they can be transparent. They're thinking about what additional resources may be needed with a team member, and reasoning with the team member about why they can or can't bring those things to them, rather than just saying we can't or we don't or whatever it may be. They advocate for their staff's needs. They think about what's appropriate for staffing levels, what's the proper staff to patient ratio, what's the appropriate equipment these people need, what's unsafe conditions, all the things that happen in a daily basis. That's really what ethical leadership is about. And I think what you'll find with ethical leaders is that they tend to handle their daily work differently, especially when it comes to mistakes. So ethical leaders, don't jump to blame. They don't jump to punish. They create things like psychological safety with team members, where folks feel comfortable bringing these things up, and really where their team members feel comfortable just talking about general life. That's what my experience has been. And in the back to the error space, we think about ethical leaders. They often ask things about, what can we learn? Not why was this someone's fault? And in doing so and thinking about that kind of thinking, especially in the perioperative setting, I think we become more of a learning organization that focuses on patient safety and improving things rather than hiding things. I think the last thing I'll say, what ethical leadership looks like in a daily sort of action, on a day-to-day basis, is about they're present during difficult moments. Okay. So when a team member needs somebody, the leader is present. When a patient, something doesn't go as hoped, they're present. They're supporting not only the team member or the patient that something happened to or didn't happen to or didn't go the way we wanted. They show up, right? And they struggle with their teams. They sort of exude certain characteristics, and they don't disappear when things get tough. And I think ultimately, at the end of the day, what all of this is about, is it's about ethical leaders are always thinking about how they build their moral muscle. What do I need to do to continue to be stronger as a leader from an ethics perspective? I think ethical leaders are never really satisfied with where they're at. There's always a future destination that they keep going towards. Not that they don't feel fulfilled, because I think ethical leaders do, but they're always thinking about, how do I make it better for me, for my team, for my patients, for the folks I work with, for the organization I work with. And I think that's all about developing and building what I would call a moral muscle.
Very interesting. You had mentioned building moral muscles. So I'm going to kind of, elaborate a little bit on that. when I'm asking you this question, what are the key personal characteristics that form the foundation of ethical leadership? And how can perioperative leaders develop these traits over time?
Yeah, that's it's a great question. So when I think about ethical leaders, you're spot on. I think about certain characteristics that leaders have, and I think about certain behaviors that they have. And so there's lots of literature on this, but I tend to think there's a few things that there are certain characteristics that you see in ethical leaders time and time again. So if we each were to sit back and envision who we thought as a moral manager, who would be the leader we would consider an ethical leader, we tend to find similar things like care for others, right? So what does it mean to step into a space and to be other focused? We find things like honesty. That doesn't mean being absolutely honest every time. I think, we that's one we struggle with a lot on a daily basis. But I think having honesty at the forefront about being fair, about treating people, similarly when it's due, about giving each person the respect and dignity that they're due. I think about things like integrity, about acting how we act when people aren't around. I think about things like trust. How do we build trust with folks? And the one that I've been thinking a lot more about is about humility. And I will tell you and the listeners, I do my best around humility. My kids have lots to say of whether I'm humble or not humble, but I try my best. And I think there's a lot to be said about when we get those certain characteristics together, what we tend to see. And in my world, when I think about these kinds of things, those characteristics are really about building moral people. And I think most of us get that stuff right. We're good about navigating the moral person side. The other side, which I'll just sort of expel on just a little bit, is about the behaviors, and we can talk more about that in a little while. So just because you have certain characteristics doesn't, to me, it doesn't mean it's going to lead you to be a sort of ethical leader, right? I think there's this other stuff, which is the constant behaviors that I sort of talked through, that you might see in an ethical leader, about showing up, about demonstrating how ethics is a priority, about, using the right incentives to drive behavior, about, talking through X, Y, and Z with a team member, about, giving them the opportunity to raise up ethical concerns when those things happen, and pointing them to the right resources.
Well, Jason, you've mentioned during this last question and answer about key behaviors related to ethics. Two key elements, honesty and humility, are extremely important in perioperative practice, obviously. What are some examples, I should say, that you can provide and will be willing to share with us for our audience today?
Yeah. So let me step back. I think there's lots of things, right, that can happen in for the audience about types of ethical issues they see. I think one thing I'll sort of speak to about ethical leadership, right, in this context, is I think the thing that we tend to miss is that leaders, we tend to think that ethical issues for leaders are just part of the responsibility of being a leader. So you've got an issue, tough, deal with it. That's what we tend to say to leaders. I imagine, well, you've been in settings before where you've confronted with a challenge about values, and you're saying, well, it's just my responsibility. I need to deal with it. And I think that's not fair to leaders, because I think they all experience their own, you know, relevant challenges. May those challenges be things around particular unique issues around staffing. That's a big one that we see a lot of, about folks in this space might be uh, what what surgeries do we prioritize? How do we prioritize those surgeries when it comes to the OR? And then the other thing I think about, the types of things that create challenges or struggles, are really back to this point that I was talking about before, about the behaviors. I think we as leaders struggle with some of the behaviors that we need to think about doing on a daily basis, right? So, in the framework that I've constructed or thought through, I think about how do ethical leaders demonstrate that ethics a priority to their team, and in doing so, create that space for them to raise up whatever unique ethics issues happen. trying to elucidate a list of ethical issues that might happen for a leader or for their team is really tough for two reasons. One, one couldn't adequately ever address name all issues. But then two, what we tend to find is that when we give a list or examples, which it's appropriate to do so, people fixate on the fact that those are the only ethics issues that are experienced in a particular realm, and that's just not true, right? That's not true. So when I tend to think about this stuff, I think about it in a broader sort of context about what issues do leaders face as a result of either some of the behaviors that they need to focus on or some of the characteristics they need to draw from. I hope that that got to your question and answered what you were looking for.
Absolutely, Jason. It leads me to another question. How do our personal values sometimes conflict with institutional pressures in healthcare now, today, more than ever? And what strategies can individual team members use to navigate those situations that are challenging for us today?
Yeah, so I think the first thing I would say is we're all going to have value conflicts. Let's just all accept that as a given. We all are going to work in healthcare. Healthcare is a value-laden industry. That's just the way it works. We all bring values to the table. Every individual who works in that organization, the organization brings values, the leaders bring values, the community brings values, the patients bring values. And so it's not surprising that we're going to have tensions about our personal values and institutional and the institution. So it's a broader scope than what we tend to think. So I think the first thing I would say is, and I'm biased, I'm just full transparency. I think every staff member in every healthcare organization ought to have access to ethics resources at large. So whatever those mean, that's up to the institution to figure out. But I would, at a minimum, say they need to have access to resources who are trained in how to address these problems and the knowledge areas that are required. So things like the ethics of informed consent, of capacity, of surrogate decision making, of end of life treatment, a beginning of life treatment, truth telling, honesty, disclosure. I mean, I can pull out a book and we could read through them together today. But I think we need to have team members need to have access to those resources, both leaders and non-leaders alike. Okay, so that's the first thing I would say. The second thing I would say is more geared towards, I guess it's more geared towards leaders, but it could be broader than that, is this. It's important about getting clear about who we are, right? There's some really interesting research that shows that most people, when they join an organization, don't have their moral framework fully developed. Okay, it's mostly developed like, I've been around the block. Clearly I don't have any hair. I've got kids. I'm older. I'm closer probably to retirement than I am to starting. But there's still framing of my moral framework as I work in an organization. And what the literature says is that we find out and fill in that moral framework from our one-up leader. So if Lo, you were my one-up leader, and I'm not accusing you of this, so please don't take it this way, but
No,
I see you leaving every day early from work. That fills in what's acceptable behavior, right? That tells me, oh, it's okay in this organizational context to do X, Y, and Z, versus going to our team and saying, hey, we're making this decision on this unit because of X, or we're doing because of Y. That fills out their framework too. Oh, transparency is important here. Oh, look at this, little leads from values. Leading from values is important here. And it helps fill in that framework. I think even when you have that stuff, you still have to do there's one other thing after getting to know yourself. And I've done this with lots of leaders across the country, is understanding what your core values are. And there do have to be non-negotiables, though. There do. We can't continue to be who we are if we don't have a core of who we are. And if we're willing to violate that core, then maybe it wasn't really the core, or you're no longer going to be the person that you say you are, right? So I think about that in light of some other research that looks at how do we make sure we stay consistent with our core. And I imagine all the listeners probably have seen, but Pinocchio is probably one of the best movies about this whole phenomenon. And so Jiminy Cricket, if you remember the movie, it is this character that sits outside of Pinocchio and tells Pinocchio about his behavior. And if you ask folks about what that is, it's conscience, right? It's this external constraint on the way that Pinocchio behaves. I think we need that kind of stuff for us as leaders to make sure we stay true to who we are. And so I'm not going to show you but I have behind me in my office a card that says, here are the things that are important to me. These are the core things to me. And I look at it every time I send an email. I look at it every time I have a conversation. I have a team member, every time I have a conversation with someone else, when I'm writing a paper, when I'm doing whatever. It helps to externally remind me who I am and who I want to show up. And so when I get into that situation that you talk about, where I have a personal conflict with an institutional value, I can reach out to the resources. I can tell why this is a tension for me because this is something that's core, why it's creating a struggle. And then, the resources can help me navigate that. It may be, I'm maybe misunderstanding what's going on, right? There's lots that could be happening in that conflict. But I do think at the end of the day, there are things for me that are non-negotiable. It's these core things to me that if I worked for an organization that violated them, I may have to leave, or may have to figure out a different setting to be in that organization so I don't have to violate who I am.
Yes, I agree. Some of our listeners would like to know about the differences between having good intentions and demonstrating ethical leadership behaviors.
Yeah.
Can you share with us some experiences or examples and
Yeah.
how this might actually play out?
Yeah. Yeah. So I want to make sure this is a PG podcast. So I won't say what I was told back in grad school. But it will say the road to wherever is paved with good intentions, right? Is the normal saying. And so um, good intentions get us a certain way, right? But ethical leadership is really moving beyond passive acknowledgement of what's happening in a situation. So I may have good intentions to do something, but it doesn't mean I move to action. Ethical leadership asks us to actually move to action, to do something, to have a behavior, as it were, right? So it might be having a difficult conversation with a team member. Oh, yes, yes, we're not going to tolerate behavior in this OR, about incivility in the OR, right? And we say that, you say that, Lil, I'm going to pick on you again just because it's our conversation. But you say that, and then a nurse in the OR is rude or disrespectful to the rest of the team member. A physician is rude or disrespectful, or APP, whoever it is, and we just allow that behavior to go on. And so people will say, well, you said you were going to do that, but you don't do it, right? Good intentions. Well, I had the intention of doing it, but here were the circumstances why. Good intentions are good and something we should try and do, but ethical leadership says we're going to actually do something. It's taking the next step, having the courage to actually step into a space and do something. So, for example, a leader might, with good intentions, might notice that certain staff members are excluded from decision making, but think that, well, I really should probably include those folks. And then when the time comes around, they don't, right? An ethical leader comes at the table and says, yep, I need that. I know these people should be included. And then I do something about it. So what do? I create formal structures or like regular forums to include people in conversations. I have staff members rotate on committees so they can be involved. I have a structured feedback process, whatever it is. There's something more that ethical leaders do. They're always driving towards sort of creating behaviors or acting in a way that enables those team members to sort of engage.
Excellent. So, my next question would be, how can experienced perioperative leaders model ethical decision making in real life
Mhm,
situations,
mhm.
to help our new members that are joining perioperative practice develop their own ethical leadership capabilities?
Yeah. So I know this sounds a little silly, but I think it can be this obvious. Is to say, I'm doing it. Hey, Lil, I want you to know I'm engaged in ethical decision making here, like pointing it out for the folks who, not that they're oblivious, but pointing it out for people. We tend to think what we tend to do is make assumptions about the way people reason. Let's just be honest. We all do that. Okay. But I think being transparent and open about, hey, I'm engaging in ethical decision making. I think the number one way you can do that as a leader is to tell people why. Everyone wants to know when you make a decision why you do it. They may not say they not want it, but they do want to know it because if because what ends up happening when you don't tell it is they'll fill in the story. So why did Lil do that? Why did Lil take this person off the schedule? Why did, whatever it may be, whatever the issue, why did you buy this device, versus this other? Why are we, closing down that OR versus whatever it may be? If you don't say because and then give the answer, right? Teams will fill that in. So what follows after that because that can be emulated down is values. We're doing this because of X value, and that should align with the organizational values. That's what the whole goal of leaders is, to lead the organization consistent with its mission, vision, and values. And so everything we do in a space should be connected back to that value. So Lou, you're deciding to close down OR 13 for whatever reason, right? And that you tell the team, we're going to close that room down. We're going to try and make sure the staffing gets dispersed to all the other rooms. The reason we're doing it is because we're trying to be good stewards of our resources. We recognize that we don't have enough surgeries coming in today, and our obligation, right, or our one of our core values is to be a steward in this organization. Is we have to live up to the financial responsibilities we have, both to ourselves and to our community. And there's an easy way to start doing that. And then what ends up happening is the people who report to you, or the team members who may interact with you, they don't even have to report to you, will see you doing that, and they'll start doing it. So they'll start engaging in values-based decision making, right? There are tons of formal structures we can teach leaders to use. I mean, I have a structure, but it doesn't even have to be as robust as a structure. The simple first step that leaders can do that can help those that report to them emulate that is to start saying the because, why, and how is that consistent with the mission, vision, and values of the organization.
Great. So to kind of wrap it up with my last question.
Yeah.
For our listeners, okay, who want to strengthen their ethical leadership, starting tomorrow, say, what are 3 concrete actions that they can take to develop a building block, that moral muscle, and positively influence the perioperative environment as a whole? Not just the environment, but practice as well.
Yeah. Okay. So I'm going to sound like a broken record based on our last question, but it's worth repeating. We don't learn things the first time we hear it. So I'm going to say it again and again. I think we need to talk about the because. We need to explain to people why decisions are being made and base it on organizational values. Right. This is why we're doing X, Y, and Z. 2, I think everyone should go out and identify their local ethics resource. I think they need to know who they are. I think they need to connect with that the people on there, whether it be a clinical ethicist or an ethics committee, connect with that person and start having conversations with them about what they can be doing in their organization to connect the work of the ethics resources within the organization back into the perioperative space. Because there's lots of stuff going on, both for the leaders and for the team members, but I don't know how frequently we're addressing those things. And then 3, I think we have to the last concrete thing that people can do is we have to stop relying on that we're good people. Okay, I believe you, Lil. I think you're a good person. I've only known you for a little bit. Our conversation about Italian and our heritage. I think you're a good person. That being said, there's more to being an ethical leader. We got to think about our behaviors and our actions, right? And we're not often thinking about that when we ask ourselves, do I think I'm an ethical person? I'll tell you, I talk with people a lot across the country around this issue. And one of the things I find is I often ask, how many of you in here think you're an ethical person? And everybody puts their hand up. And then I ask them to score themselves on a 1 to 10. And everybody tends to put themselves really high, right? Is that the case that all these people are 9s and 10s or whatever it may be? Maybe, right? But I think what they're thinking about is those characteristics. Do they exude those characteristics? Not whether they have the behaviors needed in order to lead them to sort of ethical leadership. And so I think that's what I would recommend to the audience is think about how you're making decisions based on values and explain those. Connect with your local resource and then start to think about your behaviors as an ethical leader. How are you incentivizing the right decisions? How are you engaging in ethical decision making? How are you demonstrating that ethics is a priority? How are you, setting expectations around ethical practice? Those kinds of things, I think, get to the key of what we need.
Thank you, Jason. As stewards in healthcare leadership, specifically, ethics is very important, and in our day-to-day life as well, as in our practice.
Mhm.
So I have to say, this was very, very enlightening. Thank you so much for participating on our podcast today. And if anyone has questions, feel free to reach out to us, and we'll make sure that Jason gets those questions and we're able to answer, respond to all of you. So we'll look forward to seeing you on our next podcast. And again, Jason, I'll look forward to seeing you at the conference, at the Southeast Conference in down in Florida in the
Yes.
fall. So again, thank you very much.
Thank you very much. Look forward to seeing you all down there. Take care.
Here.